Cody, the Australian Sex Discrimination Commissioner, has voiced strong concerns regarding the Queensland government's recent decision to halt hormone treatments for gender dysphoria in young people. The Queensland government's ban on puberty blockers for new patients seeking treatment for gender issues has been labeled discriminatory by the state's sole dedicated LGBTQI youth service. This condemnation underscores the growing controversy surrounding the policy's potential impact on vulnerable young individuals. Commissioner Cody explicitly stated that the ban has the potential to harm the physical and mental well-being of children in Queensland who are currently awaiting care. This statement highlights the deeply concerning implications of denying access to vital medical interventions for a group already facing significant challenges. The decision raises serious questions about the government's commitment to providing equitable and evidence-based health care for transgender and gender-diverse youth. The Queensland Health Minister, Yvette D'Ath, justified the ban citing an internal review prompted by allegations of inadequate medical support and parental consent issues at Cairns Sexual Health Service, a facility offering pediatric gender services. The review, triggered by reports of potential shortcomings in the provision of care, identified process issues, although it concluded that no evidence of patient harm had been found. Despite this finding, the government proceeded with the controversial ban. The Queensland government's decision is also informed by the UXCAS review, a report commissioned by the National Health Service and released in April of the previous year. This review, while influential in the UK government's subsequent decision to impose an indefinite ban on puberty blockers for under 18s excluding clinical trials, has not gained universal acceptance within the medical community. Notably, its findings have been rejected by the Royal Australian and New Zealand College of Psychiatrists. This divergence in professional opinion underscores the complexities and uncertainties inherent in the debate surrounding gender-affirming. In contrast to the Queensland government's stance, numerous prominent Australian medical organisations endorse gender-affirming healthcare. These include the Australian Professional Association for Trans Health, the Royal Australasian College of Physicians, the Royal Australian College of General Practitioners, and the Endocrine Society of Australia. The weight of this professional consensus further underscores the potential negative consequences of the Queensland government's policy. The new LNP government's rejection of the recommendations from the review and its reversal of the previous government's decision to expand access to these services have exacerbated the concerns raised by advocates for transgender youth. This action has sparked intense criticism from LGBTQI plus advocates and medical professionals alike who emphasize the importance of evidence-based healthcare practices in this area and express grave concern for the welfare of young people affected by this policy change. The debate highlights the ongoing tension between political decision-making and evidence-based medical practice in the highly sensitive area of gender-affirming care. For those struggling with the issues raised in this article, crisis support is available. In Australia, Lifeline provides assistance at 131114. Samaritans in the UK and Ireland can be reached at 116 123. Additional international helplines can be found at befrienders.org. The ongoing dialogue surrounding this complex issue underscores the urgent need for compassionate and informed policymaking that prioritizes the disparity between the Queensland government's approach and the prevailing professional consensus demands further scrutiny and critical analysis. The potential long-term consequences for the physical and mental health of affected individuals warrant significant attention and careful consideration. The debate continues to evolve, underscoring the need for ongoing dialogue, research, and a commitment to evidence-based approaches in shaping policies related to gender-affirming healthcare for minors. The future impact of this policy on the lives of transgender and gender-diverse young Australians remains a critical area of ongoing discussion and concern.